Stories are the reflection of our lives, and it's how we learn, it's how we understand our context. Some people still tell stories with art. Many of you know Regina Holiday, a wonderful woman and patient advocate and artist, and she's taught us about her stories and those of many others with her paintings and her murals. I'm fortunate to have a painting from her on my jacket where she interpreted some stories that I told her about what's important to me in the healthcare space, and she put them into pictures, and I'll tell you more about them later if you like. For now, I'm just going to let you enjoy this while I talk. We start our lives with stories. Dr. Seuss was my first doctor. I'm sure he was the same for many of you. We learn about our families, our culture, our heritage from stories that our parents and grandparents tell us. We make up stories as children to understand the world around us, to explain our questions, our fears. Now, I'm a numbers guy, so bedtime at my house includes a couple of storybooks and some math. I know you're thinking this guy is so cool, and his kids are going to come out so great. But we know when we do math with kids that what we should talk about is word problems. We put the data in the context of stories. I had the privilege of going to medical school, and like many medical students, I was most impressed by the teachers who told us the most colorful stories about patients they had seen and learned from. Indeed, many of us were drawn to medicine in the first place by people like Oliver Sacks and Abraham Verghese, who taught us that you can be a science geek and a student of the humanities at the same time. That's what makes many of us tick. But somewhere along the way, many of us lose a piece of our humanity. The training process for doctors can be grueling. There are long hours and short sleep. And I know that I'm not the only one who remembers so clearly the night when I actually wished Mr. Jones would hurry up and die so that I could get some sleep. Succeeding as a doctor requires one to be extraordinarily efficient. And stories are not efficient. We learn to boil patients down, to reduce them to facts and numbers, so that Mrs. Garcia, the mother of 6 who came from Guatemala after she lost her husband, becomes simply gallstone pancreatitis, room 318. Now, this mindset is codified in the way we talk about patients, in the way we organize our medical records. One of my favorite examples is the history of present illness, or HPI. And that's the part of the doctor's note in which he or she is supposed to describe what the patient said, why the patient came to seek care in the first place. And the acronym really takes away the personal part. There's no patient here. Arguably, this gets worse in the new era of electronic medical record systems, or EMRs. When I see patients, I need to fill out a seemingly endless series of forms on the computer, which we call an EMR, with structured data and very little room to even think about the patient's story. Now, I have a colleague in the urgent care center where I work, and he's been practicing medicine for over 50 years, and he is a fabulous storyteller. And he tells stories about seeing patients over many decades in different countries, diagnosing infections and diseases that we don't even see anymore. And since a couple of years ago, when we implemented an EMR system in our hospital, this is what he spends a lot of time doing. Now, mostly this is time taken from talking with patients. There's hope. Organizations today are working on tools that will allow Holly, my colleague, to do what he does best, listen to patients and then interpret their stories and just speak into a microphone. And technologies like voice recognition and natural language processing will take the spoken word and automatically fill out the electronic forms. We're not too far from a technical perspective of making that happen. There's even more hope in patients like many of you who aren't waiting for doctors to figure this out. You're finding each other, you're telling your stories to each other, and you're learning from each other's experiences and wisdom. And there's a huge amount for all of us to in turn learn from that process. I want to do a case. No good medical talk is without a good case. So this is a CT scan, actually 2 CT scans. And imagine that the patient is lying down and his feet are coming out at you, and you're looking at a slice right through the middle of his head. This patient is me, and if you can see the fine print, the image on your left was taken about 7 weeks ago on August 1st. And I had what's called a subarachnoid hemorrhage, a bleed in my brain. I was incredibly lucky. Most of the time, subarachnoid hemorrhages are caused by a ruptured arterial aneurysm that bursts. And arteries are very high-pressure systems, and a lot of blood spills out and generally causes terrible damage. In my case, I was one of the 5% or so of people who have this kind of bleed, where it actually comes from a small vein, low-pressure system, very little blood came out, and you can see on the follow-up CT scan a couple weeks ago, the blood's all gone. No long-term problems, and actually have the same chance of this happening to me again as any of you do. So my story is not special. It's no more special than the hundreds of stories represented in this room alone, but I learned something important and I want to share it with you. When I told this story to my doctors in the ER, I told them something along the following lines. I was running on the treadmill, 5:15 p.m., got a sudden onset headache at the top and back of my head. It didn't resolve with rest. And I noticed I had some stiffness in my neck. We call that meningismus when it happens with moving. I hadn't had any fever. I had been well until the headache started. About a half an hour later, I started throwing up. And at no time did I have any neurological symptoms like weakness or numbness. I didn't think about this explicitly, but I told my doctors my history of present illness. I just knew that's what they wanted to hear. But when I told my loved ones the story, it came out a little bit different. I was running really hard on the treadmill. I suddenly got a headache. My neck was kind of stiff, but I knew it wasn't meningitis. I didn't have any fever. Nothing else was going on. So in the back of my mind, quite literally in this case, in the back of my mind I knew that it might be a subarachnoid hemorrhage. But that couldn't happen to me. So I dismissed it. I don't even think it came to my consciousness, that conversation that I had about a bleed in my brain. I took a shower. It didn't go away. I called my wife. I said, "Hey, babe, I'm going to come home a little bit early. Can you get someone else to pick up the kids? I think I need you to be home when I get home." I remember being in the scanner, in the ER, alone. I went through the machine once. And then the tech came back into the room and said, "We're going to run you through one more time." Oh, shit, I said to myself. So those stories contain approximately the same data. But there's a lot of context missing in the first one. Context about what I understood, what I didn't understand. Context about my fears, my preferences. And I was thinking in the weeks that followed, how can we learn more about how stories can improve the quality of care? Not just because it sounds like the right thing to do to listen to patients, but because it can actually help us all do our jobs better. Oops. And while I was thinking about this, I met someone who was actually doing something about it. Lucien Engelin, many of you know on Twitter as Zorg20, was introduced to me by Dave DeBronkart, one of the people I'd been chatting with about this. And Lucien recorded this video for us yesterday, and I'm going to let him tell the next chapter of this story.
Time has become a currency in healthcare. Checklists, protocols are very important, but on the flip side, they disrupt conversation time, or maybe we should say, the time to really listen. Talking to med students, we found that listening to patients, telling about their disease and living with it, could help them a lot. And strange enough, in general it appears they only have little time with patients to really listen. My idea was that maybe a video library could help new and experienced healthcare professionals to improve their compassion, improve the communication, the treatment, and the health of their patients. In creating a platform for patients to submit their health story through a YouTube video channel, to me seemed to be a perfect match. And as Radboud University Medical Center in the Netherlands, we are an independent, non-commercial, and trusted party. With our Reshape and Innovation Center, we have already set up numerous initiatives like TEDx Maastricht and Compassion for Care. With this new project, called My Health Story, medical students will curate the submissions before they appear online. And we will conduct research on the videos to learn how medical students and doctors can best learn through this crowdsourcing program. And of course, patients can learn from each other as well. And patients will be able to remove their videos at any time. So we are inviting you to help us. Please, share your stories for the benefit of better professionals and through that, better healthcare. And please encourage others to do so as well. So whenever you hear someone tell a story that could help, point them out to the My Health Story website. And basically, it's one of our next steps of Reshape Healthcare. Or as e-patient Dave asks all of us, let patients help. So that's the thing we're trying to do. Let patients help.
So thank you to Dave for introducing me to Lucien about a month ago. He was thinking a little bit more about the academic medical education side of things. I was thinking more, from having recently been a patient, about how we can learn from each other to improve our own care and give our doctors better tools to take care of us. So we're now collaborating on this fabulous project. my health story. Technology, like EMRs, are in some senses pushing us away from communicating the way we learn to as children, from really embracing and learning from stories. But technology can also bring us back, maybe even closer. When EMRs start working really well, we will stop noticing them. They'll just be there like the thermometer. And projects like My Health Story are things that we should work on not so that we can appear to be engaged or so that we can be part of the conversation, as we sometimes say. These are projects we should work on because there's real research to be done and real improvements in the healthcare system that can result from learning from the narrative. I think this kind of work should not just come from the marketing department. This is R&D. This is real investment. I think some of the most important innovations in the next several years at the intersection of medicine and technology will happen at the intersection of the story, the narrative, and the data, where each can be informed by the other. And I look forward to helping be a part of that next chapter with all of you. Thank you.